Your heart is a muscle that pumps blood to all parts of your body. When you have heart failure, your heart has trouble keeping up with the amount of blood that it needs to pump for normal function. Heart failure is called congestive because as the heart has more trouble pumping blood, it can cause fluid to back up in the body. Heart failure is a chronic condition. There is no cure for heart failure, and we want your heart to work as well as it can. Every day you need to make good choices to protect your heart. We want you to have a good quality of life. Besides taking your medications and going to the cardiac rehabilitation, how you eat is very important in helping your heart work as well as it can. Here are 3 main nutrition things that you can do for a healthy heart when you have heart failure. The first is to follow a low salt or low sodium diet that is no more than 2,000 milligrams of sodium. This will help your heart work much better. Please view our low sodium diet video for details on how to follow a low sodium diet. This is an important part of the diet for heart failure. Secondly, drink no more than 64 ounces of total fluids a day. You want to limit your fluids to no more than 64 ounces a day or 2,000 milliliters, which is the amount of a 2-liter bottle of pop. We don't want you to drink pop because it's not good for your body, but the amount in a 2-liter bottle is a good picture to have in mind when managing your fluid intake. It's important to balance your fluids and salt for a healthy heart diet. Keep in mind if you eat less salt, you will be less thirsty. Limiting fluids includes common fluids like water, juice, milk, coffee, and tea, as well as foods that are liquid at room temperature like ice cream, popsicles, and Jell-O. Soups can also be a major source of fluid. They are high in sodium usually, so it might be best to avoid these altogether. Let's go over ways to track your fluids. Choose the method that works best for you. Use your hospital water pitcher. If you have half a liter pitcher, it can be refilled 3 times per day for 1,500 milliliters. This leaves up to 500 milliliters more for fluid and foods, such as ice cream, adding ice to drinks, taking medications, or drinking water when brushing your teeth. The lines on the pitcher will show you how many milliliters or ounces you have drank. Note, if you have a large hospital water pitcher at home, use a limit of 1.5 refills. Or, in the morning, pour 64 ounces or 2,000 milliliters of water into a large pitcher or a 2-liter soda bottle. Every time you drink any kind of fluid, pour out that same amount of water from the pitcher. When the pitcher is empty, you will have reached your fluid limit for the day. You can also pour drinks into 8-ounce cups for a total of 64 ounces or 2,000 milliliters. Use smaller cups and increase the number of portions for more beverage variety. Please refer to the Limiting Your Fluids handout in your heart failure book for more tips on how to do this. The last thing we want to cover is weighing yourself each and every day. Please be sure to weigh yourself after using the bathroom and before breakfast every morning. Weigh yourself at about the same time, wearing clothing of similar weight or no clothes at all to get an accurate measure of weight. Be sure to call the heart failure nurse navigator or your cardiologist if you gain 2 pounds or more in a single day, or if you gain 5 pounds or more in a week. By following these recommendations, you can actively manage your condition and help have a better quality of life with heart failure. For more information, including limiting fluids, low sodium diet menus, food lists for a low sodium diet, and how to season food without salt, please check our patient education handouts on this topic.